One of the most difficult things that I have to deal with when we have patients coming for their regenerative medicine evaluations is the idea that they waited too long and now their options are very limited. For those of you that don't know me, my name is Dr. Nikhil Verma. I run an interventional pain and musculoskeletal health practice in Columbus, Ohio, with a focus on regenerative medicine. And today I want to talk about when patients wait too long before they seek after treatments that could potentially help them in the long run. And this has been happening quite frequently, as I said, in the past few weeks, past few months, of my practice, and it's kind of been a recurring theme. And I thought it's worthwhile to bring it to the forefront and to the attention of my audience and whoever else is out there. So, for example, I had a patient come in last week and she's getting a knee replacement in a few months. And we were just talking about her symptoms, and she's gotten 4 or 5, maybe more knee injections in both of her knees. Now, if you have been following my stuff for a while, or if you want to go do your own research, you'll see that even a singular corticosteroid injection into a joint increases your likelihood and the speed of which you'll get a knee replacement or a joint replacement. This is really evident in the data as we continue to see this happen over and over and over again. So I don't know if doing multiple injections causes the same thing, or if a singular injection is the same as doing 4 injections, but the idea is that if these patients were to come to an individual that has a better grasp on musculoskeletal health and try to focus on preserving the joint and preserving the tissue integrity and working on imbalances, potentially putting on some supplements that might be beneficial, then are we helping that patient move along the process of maybe preventing a knee replacement? And then we start talking about the orthobiologics, the platelet-rich plasma, the bone marrow aspirate concentrate or micronized fat, laser treatments, shockwave treatments for certain conditions, EMTT treatments. Can we put these together and help that knee, for example, be better so this lady's not getting a knee replacement at a young age? In my practice, I see a lot of spine patients, the patients that have degenerative disc disease, facet arthritis, spinal stenosis, listhesis, or slippages of the vertebrae. We see all these kind of things, and quite frequently, the patient tells me, "Oh, I just put it off. I put it off. I put it off." And by the time they come to me, they're expecting some sort of miracle. And those patients that have severe stenosis and have severe disease or pathology in their spine, those are the hardest to treat. And those are the ones that I actually do say, I'm not 100% certain that this medication or this treatment plan is going to work for you. I'm certainly less willing to even try it on them. And I've been surprised in certain cases where the procedures have gone flawlessly and the patients have gotten great relief. But I've also had a few patients where the procedure was not a home run. And I would say that they got some relief, but they did not get that expected pain relief that they were looking for. Now, this is why it's very important for your physician to be in your treatment algorithm early and not late. Because if you continue to let these disorders pile up over time, sometimes the only thing left to do is surgery, and these regenerative medicine procedures aren't going to work. Your physical therapy, your supplements, your stretching, even your baseline injections, those corticosteroid injections, they may not be as effective if you're not making that area structurally sound, supported, and helping your own metabolic rates. And when I'm talking about supplements, a couple things should be highlighted here. We've been prescribing chondroitin and um, other one slipping my mind right now. glucosamine and chondroitin for quite a while now, and we're starting to see that, yeah, it may be effective for pain control, but it can also cause some cognitive decline in some people, and it can cause some other systemic issues. So maybe that's not the best thing that we should be using for those kind of patients. And a recent video, an article that I've been talking about with Dr. Stephen Murphy, who talked about the mitochondrial health of musculoskeletal conditions, especially osteoarthritis. We see that when the cells in the area go nascent and they become older, they start dying off, and how the mitochondria really affect, and they're the, we'll call the CEOs, his term, or maybe someone else's term, not mine. The CEO of the cells, if things start shutting down, they say, all right, we're done. We're closing up shop. Let's get out of here. Versus when we use things like platelet-rich plasma or bone marrow aspirate concentrate or maybe laser therapy, then we're actually reactivating some of those sacient cells and those nascent cells and turning them back on and activating again. That CEO, that mitochondria, acts as a more of a regulator to start pumping up production and decreasing some of the inflammatory markers. So when we delay, we delay, and we delay, and that pathology gets worse, worse, and worse, more of those cells are going to die. More of the healthy progenitor cells are going to become deactivated or unactivated, and they may never have a chance to be activated again. And this is going to worsen pathology and worsen disease as it moves forward. And that's not to be say that, some of these treatments, not everything needs treatment. That's not my argument here either. You don't necessarily have to go and get platelet-rich plasma, bone marrow aspirate concentrate, or stem cells, or laser, shockwave, but it's worth having a conversation with somebody who's a musculoskeletal expert to give you an assessment, to see what's going on, to understand what your goals are, and give you a treatment option that may include something more along that lines of gait control or bracing or foot wedges, and giving you the proper supplements. For example, something like Urolithin A, who's been shown to help with those mitochondria that we're talking about, and maybe giving you a mitochondrial stack instead of just putting you on a medication because they read it in the journal or that's what their colleagues are doing. So it just an warning sign I want to give everyone out there that, if you're starting to feel musculoskeletal disorders, it's in your best interest to not to ignore them. In your best interest to follow up with somebody who knows what they're talking about. And I don't mean to throw too much shade at my colleagues in the primary care world. They are not experts in the musculoskeletal health system. Not unless they were trained in sports medicine. And even then, some of them are more focused on athletics and not as much in the musculoskeletal system as its general population. And no shade to my orthopedic colleagues who really know the musculoskeletal system, probably know better than most people that claim to be musculoskeletal experts, but their solution quite frequently are injections and surgery. You need to have someone in the middle ground, and someone such as myself or some of my colleagues, that we build that middle ground for purpose to help our patients weigh out their options. And also to tell you, hey, listen, you are a prime candidate for surgery. There's nothing else that we can really do outside of surgery to help you out. And that's definitely a conversation I've had in the past few weeks as well. Telling patients is like, I don't want to even mess around with doing some of these other procedures because I'm not sure the effectiveness it's going to have on you. At least go talk to a surgeon. Now, granted, some of them have come back to me and said the surgeon said that they say continue with injections, and that's fine. If we're going to do certain injections, at least we have a game plan for everyone going forward. So that's my big spiel for the day. The saying, I think it was an old Native American Indian saying that goes like this: don't let the whispers of pain become cries of agony, where you ignore the small inconveniences, but in the background, those things magnify over time. Anyways, I hope you found this useful. I hope you enjoyed it. If you have comments and questions, please drop them below. Please give me a follow, subscribe. And if you have anything else to talk about, I'm happy to discuss. All right, take care. Bye.